Hi, I am Dr Sudeepta Ashe, consultant ENT and head and neck surgeon. Today we shall discuss about most important topic, that is sleep apnea. Most of the patients that come to the OPD, they complain of sleep apnea or they come to the doctors because of snoring. Though you should know what is sleep apnea and what is snoring. Snoring means the patient will complain snoring to the doctors when the patient relatives or patient attendants come with them and they will tell the patient is having snoring at night or having daytime. So what is snoring? Snoring means the patient will snore at a daytime when at the sleeping time or may at night times. So during the process we should know what is the period of snoring. When the patient is sleeping, when the patient is awaking, we should know, and after that we should evaluate properly about the snoring. So we should discuss about what is sleep apnea. So mostly sleep apnea, for that we should know what is sleep cycle. A sleep cycle is consistent of a patient or a subject or a person should sleep at least for 7 to 8 hours. During that we have to know what is the most important thing is the sleep index. What is sleep index? Is if a patient is having 30 episodes in a 30 episode, at least in a 10 seconds we have to calculate it and give a sleep index. After that the patient should be evaluated properly about the sleep apnea. So when a patient come to us, we should first know what are the symptoms, what are the clinical findings on examinations on the OPD basis. So during that, as a ENT consultant, we should first examine starting from the nose to the laryngopharynx. From the nose, you should first see whether the patient having deviated nasal septum. Means any deviated nasal septum means there having obstruction in the nose. So we have to see whether the patient is having deviated nasal septum. Secondly, we should see any turbinate hypertrophy is present or not. And third, we should see any spur in the either side of the nostril is present or not. Then we should go to the inspection through adenoid. Adenoid means it is a lymphoid organ which is present in the nasopharynx area. We should see in a 0-degree endoscope. We can easily evaluate about the adenoids. And third is we have to see the tonsil. That is palatine tonsil. It is an important lymphoid organ which is very important to see during the 0-degree endoscopes or through the laryngoscopes. So easily we can see whether the tonsil is inflamed or not, whether the enlargement of tonsil is present or not. It may be of grade 1, grade 2, grade 3, grade 4. So we have to evaluate properly whether the tonsil is present or not. And after that we should go to the laryngopharynx area after visiting the oropharynx. Means after examining the oral cavity, we have to go to the laryngopharynx area. We have to see whether the arytenoids and the vocal cords movements are normal or not, and the patient soft palate area is normal or not, whether the base of tongue, means the tongue posterior part is adequate airflow is there or not. So we can easily evaluate all these things in the OPD basis, normally after doing an anti-rhinoscopy and also through 0-degree endoscopes and 70-degree laryngoscopes endoscope to inspect the larynx and the laryngopharynx area. All these things after evaluating, we should know whether the patient is having anything mechanical obstruction or obstruction is present from the nasal airway to the oropharynx. And after that we should evaluate what is the important cause. The most common factor or risk factor for snoring or sleep apnea is that if the patient is obese, then it is they are prone to the obesity. After obesity, they are morely prone to the snoring. So we have to also tell the patient about to reduce the weight, and the weight should be at least they should maintain the proper body mass index. It is very important. And after that, the patient have to evaluate properly for the where is the obstruction is present or not, whether is there any problem is there in the during sleeping or not. So after that we have to refer to a patient for a prior investigation, that is called sleep cycle study. In that sleep cycle study, we have to know the patient's sleep apnea index is normal or it is abnormal, whether it is in range or higher range. Then we have to whether the patient during the sleep is having the proper air flow or oxygen flow to the inner body area or lungs, we have to see that. And after that, during the sleep cycle, when the sleep cycle study, we can easily evaluate. After that, we have to see whether how to treat the patient. The most important part in the treatment of the sleep apnea is that mostly treatment is conservative, means we have to strictly follow. If the patient weight is and BMI is more, then you have to the patient have to reduce the weight, maintain the proper BMI, maintain proper weight and proper diet also. And after that, the patient should evaluate properly for obstruction. So during that period, we have to do a lot of investigation for that. For any obstruction if present in the nose or airway, we have to do a CT scan nose and paranasal sinus, so that we can easily know whether the patient is having any deviation. And second thing is that any turbinate hypertrophy is present or not, whether the patient is having adenoid or tonsils or anything growth or obstruction in the oral cavity or not. And secondly, for that we have to do a proper CT scan and MRI also. And secondly, after evaluating all these things, the treatment part is that the mostly we can easily go to the any medical treatment is mostly it is not common. Mostly for any obstruction of the disease, we have to go for a surgical aspect. So as an ENT surgeon, we should prefer how to treat properly through surgical intervention. The most important intervention for that, mostly we counsel the patient for the any obstruction that can be relieved. Mostly for obstruction of the nose, we can do septoplasty, we can do turbinoplasty. Septoplasty means whether when the patient is having deviated nasal septum, we can go for an endoscopic septoplasty, means the deviated part of the septum, whether it is cartilaginous part or bony part, we can easily do a correction of the septum that can easily clean the airway, so that through the both nasal nostril the passage of airway will be open and patient can easily breathe. And second, we can go for a turbinoplasty in the same procedure. So after doing the septoplasty endoscopically, we can do also turbinoplasty. Turbinoplasty means we have to reduce the infrared turbinate, that is called turbinoplasty. And secondly, after doing all these things, if the patient is having any adenoid hypertrophy, mostly at the age of 6 to 7 years or maximum to 8 to 9 years, we have to wait and watch. If a child or a small boy, girl come to us, we have to wait and watch for any adenoid hypertrophy at tonsil. But after 9 years or 10 years, if the adenoid hypertrophy is gradation is more or tonsil gradation is more, then we have to correct it through surgical aspect. For adenoid, the most important surgical aspect for adenoid is we have to go for an adenectomy. Conventional before few years we are doing through curettes, but nowadays we can use higher instruments or higher gadgets for that. We are using mostly nowadays we are using a micro debrider for adenectomy. So we are using micro debrider and we can also using coagulator. The most important two devices are very important for us, so that the surgery can be easily done through the endoscopic method, and it is also a vascular method. And the problem after surgery is that when the patient relieved mostly with pain, mostly when we are doing conventionally, the patient complains of pain post surgically, but when we are doing through coagulator for tonsillectomy and for the adenectomy we are doing debrider, the patient is having less pain mostly after doing a conventional surgery. So in adenoid, we are doing through the micro debrider, that is an instrument. We can debride whole the adenoid tissue and we can give a nasal pack for at least 24 hours to 72 hours or maximum to 48 hours, so that easily we can post-operatively we can easily control the post-operating hemorrhage for adenoid. And for tonsillectomy also we can go through the coagulator. The most important is that after doing all these things, the patient will complain of no pain, and mostly the stay of the patient is very less. We are keeping the patient mostly for 1 day post-operatively, and after 8 to 9 hours patient can take or easily can take food. That can be easily take oral diet, we can start after 8 hours, and liquid diet mostly after doing tonsillectomy we should prefer to do and tell the patient to take liquid diet and mostly cold diet. So this is the most important surgical aspect, and the most important surgical aspect for the sleep apnea for ENT surgeon is that when the patient is having A high arch palate is very soft palate and high palate when you are expecting that is a low air flow to the larynx area, then we can go for a uvulopalato-pharyngoplasty. It is a procedure when in the same setup we have to go for septoplasty if there is an obstruction in the nose, then we have to go for a terminal plasty. At the same setup we have to go for a tonsillectomy and we have to do uvulopalato-pharyngoplasty, means the enterpilla, the tonsil and the uvula, all these things have to be removed, and all these things have to be removed and to be corrected through easily, so that the tongue, base of tongue and the enterpillar should be gives enough space for airway. So this procedure is very complicated also, means the patient is having regurgitation mostly after the surgery. The patient complain about regurgitation and the patient is having pain also. So in the when the patient is mostly 40 years of age, when patient is not obese, then the patient is having all these problems, mechanical obstruction, so that we can go for uvulopalato-pharyngoplasty. So it is a most important surgery for sleep apnea. So during all these things, if the patient is having no such surgical aspect or any mechanical obstruction is not present, then they can go to anything such as BiPAP also they can take for sleep apnea, so that they can get oxygen supply to the larynx or to the lungs. All these things can be done, but properly I will tell all the patients, those who have been snoring at the night or at the time of the day when they are sleeping, they come to us, to any ENT consultant, and easily evaluate all these things, so that they can easily take the proper evaluation. They know what is the cause, why snoring is been going through them, and they can be easily corrected or easily treated by the doctors. Thank you.